Welcome back. My next guest is Miss Laura Delk, who is our front office supervisor at Family Practice Associates. Welcome, Laura.
Thank you.
All right, now she's one of the first smiling faces you see when you check in her office. And prior to this time, you're the person that says, "Here's the forms, fill them all out." Tell me what's in the what do you do with all those forms?
Well, those are documents that we need, such as your demographics, your clinical history. We get HIPAA papers signed. Emergency contacts. We always get your insurance information. That's just kind of stuff that we, need to keep on file, so that if we ever need to contact you, we can get a hold of you, or if there's any emergency contacts we need to get a hold of, we can do that as well. I know there are quite a bit. I'm trying to think of them, all of them, but there are quite a bit of forms that we fill out, but that's just information that we need to have on file here at the office.
So what are some things, if I'm coming to the doctors, are certain things I need to bring, like my insurance card or other things?
Yes, insurance and picture ID. Almost all visits, you can bring those just in case. Everybody knows insurance has changed all the time now. Best to keep your card with you, your insurance card, so that we know if we ever need it, if we ever have any questions about it, you can have that on hand. If you're about 16 to 18 driving age and you come in without your parent, you're going to need to know your emergency contacts, who's a subscriber of your insurance, that kind of thing, so that we can keep that on file also.
All right, so we've got all this, and up to now we've been doing most of it all on paper forms, but there's a new, easier way, we hope easier way to do it.
There is, I believe that there is. It's actually called Phreesia. They're tablets, so no longer paper. It's going to be a lot easier for elder folks especially. There's going to be about the forms that we actually give you, they're going to be on here. So it's going to be one question per slide. So it's going to be a lot easier to see. All your clinical information will be on here. It'll kind of help you out so that you can have all of that information answered before you get back to your visit. And I know a lot of times we ask the questions as well as the patients writing it down on the forms. This is going to help us. It'll go right into our system so that we don't have to duplicate any information.
So we hopefully get that information right there, right into the charts, and maybe save some paper and trees in the process.
Exactly, that's correct.
Now there's also a pre-visit that we might be able to do ahead of time to make it easier.
That's right. So we have your email on file. So we'll send you an email about 5 days before your visit. You can click on that, and it's going to ask you a few verification questions such as your address, your date of birth, that kind of thing, knowing that it's you. You can answer your demographics, your clinical forms right there on your phone, so that when you get to the office visit, even though we have nice friendly girls up front, you don't have to spend time chatting with us. You can go on and get to the doctor, what you came there for in the first place.
And get all that done before you get there, and avoid
that long line, if there is one, or the forms.
Or you can chat with the girls if you like.
If you want, we're always there.
All right. Now there's some other forms that you can put on there. Give me some examples of that.
We also have the PHQ-9 form. That's one of the medical forms that we actually have to have now. It's a depression screening that we are required to get. That is going to be on here. It's a questionnaire. We also have the Medicare Annual Wellness. Those are quite lengthy questions. So be able to put it on here and have it one slide per question. It's going to be just absolutely great for the elderly patients that, sometimes don't bring their glasses or can't really see or write on those pages. It's right here for you. It's a lot easier.
Well, we're looking forward to see how it works and get us information and get it right into the chart.
Absolutely. Same here.
Thanks for telling us about it. We'll be right back.